During the past week, daily figures have been highly variable. This line is a 7-day average. It shows transmission continuing to grow even as stage 3 lockdown was introduced and masks made mandatory. It's still growing. Melbourne is now 4 days into stage 4 restrictions. It takes time to see the effect of lockdowns because of the virus incubation period, so it could take until next week to see if cases fall. Professor Jodie McVernon is the Director of Epidemiology at the Doherty Institute. Professor, Melburnians have been under some form of lockdown now for weeks. Why do you think the cases haven't consistently been trending downwards yet?
So I think obviously we've all done our best, and I think the majority of the population has done their best to comply with the restrictions that have been in place. And we know that the population is moving less and is overall has been doing what they've been asked over recent weeks. We do know, though, that once the case numbers are high, that even if the measures that are in place are effective to slow down the spread, that it's very hard to get the numbers down further. So once they're in the several hundreds, even if that reproduction number, the number of cases per case, is in the order of 1, that's 400 new cases each day. And on average, that's kind of where we've been sitting over time. We also know that as community transmission goes up, we're going to see more outbreaks. And certainly, regrettably, we've seen that happening in vulnerable settings, in aged care, in meatworks and other places. And so this day-on-day variation does reflect that to some extent.
I guess people in Melbourne probably feel a little bit like, oh, gee, we've been doing the right thing and are the numbers ever going to go down? In this stage 4 lockdown, is it certain that the numbers will start going down?
Look, we know that lockdowns work. If you don't meet people, you can't infect them. So the degree of restriction that we now have that stops us from going to work unless it's absolutely essential. We obviously have markedly reduced mixing on a social level. We know that if you can't see someone, you can't spread the disease. So that's one really strong constraint. The other thing that's so important is that works together with the public health measures and the public health response, and people with symptoms getting tested, isolating themselves, and waiting for that test result and then staying isolated if they're positive. That's the other part of the equation. So both of those working together will definitely drive the numbers down.
You mentioned before the daily variability. We see some days cases in their 400s, some days in the 700s. Why does that vary so wildly?
So as I say, we will see the effects of outbreaks with fluctuations, that when there's an outbreak in a setting and people go in and lots of people are tested, we get all of those test results batched up on a single day. And these are the numbers of reports on a single day. So that really is a feature of this disease. We know that outbreaks can occur, and that's why there have been more, rigorous restrictions on settings like meatworks. We're seeing reductions in throughput and special protection measures put in place. We're seeing a lot of attention going to preventing these infections in aged care, which is a really challenging setting. But it's not until community transmission comes down that those will also stop. So those fluctuations will continue at this level of transmission.
What happens if in 3 months' time there are still 200 or 300 cases a day? Because presumably citizens can't be locked up forever. Will people end up going about their lives with social distancing and other restrictions, but then hundreds of cases a day becomes the norm?
Look, Lee, I think, the stage 4 restrictions have been put in place because we're saying that's not an acceptable norm. We know that that's not manageable in terms of the public health response. We're seeing the impact on outbreaks in aged care and other settings. And really, this is why Victoria is essentially cut off from the rest of the country, because this is not the norm that's expected for Australia. So the more stringent measures are there to get those numbers down. I think we all have to believe that will happen. I have confidence that will happen. We know these kinds of measures work, but we all need to do our bit to make that happen.
Professor McVernon, thank you very much.
Thank you.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.